Hi everybody, I am Dr. Daniel Vasquez, and this morning we are going to be placing an implant where it's going to be fully guided with timing, with a surgical guide that is timing. So we're gonna place the implant. We're gonna put already a customized heel abutment with a temporary crown that is made by True Abutments, and we're gonna be using the URIS implants today. So this is the treatment plan that we have today for our patient. Oh, by the way, this is our new beautiful machine, our 3D Axios. It takes a phenomenal imaging, so I'm very happy with my new tomography or 3D CBCT combing in the office. So this is our treatment plan. We already planned the implant placement, the surgical guide, and we're ready to place that implant. Patient's ready, and all the tools we're going to be using is ready. But before we do anything, let me show you the surgical guide that we're going to be using today. This is made by URIS. It's been designed on 3 shape and has been printed with, I believe so, with carbon. A very precise surgical guide. So there's 2 wings. It's my timing. This is the implant system. The implant that we're going to be using. So this is the abutment with a temporary crown. The fit's precise, but now what you have to do is make a beautiful surgery with so much accuracy using our pilot kit from URIS. That is a timing surgical kit for the URIS implant placement. Now over here we have my treatment plan on the tomography. Make sure that the implant, it is placed precisely with 100% accuracy. So let's get started. Our patient is already numb, but before I start working on a patient, let me explain quick how this works. Okay, now like I said, this is a surgical guide that is timing. This is a timing implant placement. So this should be and work precisely. But how are we going to do it? We need a special surgical kit. This is from URIS system. It calls pilot kit. This is the surgical kit for timing placement. Now we have the implant. But what is the depth and everything that we need to do, or the protocol for the implant placement? Well, URIS does a drill protocol that is in my screen right now. So what I'm going to do, I'm going to scroll this down. This is for my patient. This is the implant location. We're going to be using a 4.0 millimeters by 11.5 implant. That's the size of our implant. Now this is the panoramic view of the CT scan. The next thing, we're going to have the 3D view now for the implant placement. And this is the most important, the protocol. Now, going back to the implant kit, or surgical kit, all we have to do is follow the implant protocol, and that will tell you exactly where do we start, where we're going to follow, and where we're going to end. So this is literally a very simple implant system, and if we follow step by step, I know everything's going to go to perfection. Okay, so now let's fit this, try the surgical guide. It should fit perfectly, passive, no movement at all. It's nice because it comes also with the doctor's, personalized with the doctor's name and patient's name, so you don't go wrong here. Excellent. Okay, now we're going to be using tissue punch. Like in this case, we did the treatment plan on the 3D. We don't need to open a flap on this case, so all we're going to do is use a tissue punch. So first we're going to go tissue punch until we hit the bone. Are you done with that one? Remove this little tissue that we have here. Beautiful. Excellent. So this is the flat drill. All we're gonna do is flatten the surface. Beautiful. Excellent. So this is the path drill. Perfect. The 2.6 path drill is a little bit thicker than the other one. Okay, excellent. Beautiful. Now we're gonna use 2-pointer number 10. What we're working is the length. Now we're gonna go 13. Okay, until we stop. Beautiful. Now we're moving into the 3.0s, and this is the 10. Perfect. Now 3.0 and 13. 3.0, 13, and just go to depth. Excellent. So now we're moving into the 3.4, and this is 10. We are working our width. Beautiful. Excellent. Okay. We're just working some width. It's going perfect. And 3.9 by 11.3. This is our last drill. So we're gonna load it. Okay. Okay. Beautiful. So our osteotomy is completely finished. So now we're gonna do, before we do and place the implant, I'm gonna remove and we're going to rinse sterile water. Make sure there's nothing left in there. Now, check how beautiful this looks. All right, the osteotomy is completely finished. There's absolutely no bleeding. Now we are going to be ready to place our implant. Okay, perfect. So this is our implant. So we're gonna open it. It's right there. So we're just gonna load it, put the surgical guide back in, and we're gonna place the implant. So this is our implant. So we're gonna load it. Okay, beautiful. And we're going to change the RPMs. We're gonna take off the water. Excellent. So our protocol says that the depth of our implant has to be all the way down to this line, to the black line here, or the silver. It needs to go directly where the implant, and those black lines need to fit perfectly into the wings. So you have to go to here to there. So now we're gonna use our wrench for that. Now we're gonna use our wrench, position our place to depth. Vera, you're gonna feel a little pressure right now. Okay, let me hold the mirror. We're gonna verify. Gonna go to the mirror. The lines that we have on the black line on the carrier and the wing, they're very well aligned. So that's where you want it. Okay. So that's perfectly placed. So next thing, we're gonna remove the carrier, the surgical guide, and try our healing. The implant's been placed. It looks just beautiful. I have my microscope right now there, and as you can see in the screen up there, look how beautiful it looks. Now, next thing we're gonna do is try our abutment, make sure if it's perfect, and then just put the temporary crown, and we're done. So now, Priscilla, my dental assistant, already glue up, actually bond both together. We only use a flowable composite. We just sealed the temporary to the abutment. We don't edge, we don't treat the inside of the metal. I'm saying we don't treat the abutment metal or the inside of the temporary crown. So we just want to seal because eventually we're going to be using the same abutment for our permanent crown. So this is together. Okay, beautiful. Excellent. It just drops perfectly in. Beautiful. That's perfect. Excellent. We're gonna take this off now. And bites perfect. Excellent. Open please, and bite down there, bite down.
Stay very still and don't move.
This is so cool.